Okay, everyone, I think we'll be making a start now. So, hi everyone, thank you for coming to this presentation. Today, this group is going to be presenting on how do placebo effects impact treatment outcomes. And we'll be covering what the placebo effect actually is and its impact in healthcare.
Hey guys, so today I'm going to be talking about what the placebo effect is, how they are used, and how they work very briefly, which will be later talked about in detail. I'm pretty sure most of you know what a placebo is. If not, it's okay. A placebo is something that seems like a real effective medicine, but actually contains no active or a curative substance. So, for example, it could be a sugar pill or a saline injection or even a fake treatment. But the key is that the person that's receiving the treatment should not know that it's real. The placebo effect itself is psychological. It happens when the person believes that the treatment that they've been given is real and effective. But because of that belief, they start to feel better. So it's basically like you feel better because you expect to feel better. This response is not created by the treatment itself, but it's rather how the brain and the body are reacting to the belief in the treatment. Researchers use placebos in clinical trials to understand how effective a new drug or a therapy is. For instance, some people in a study, they might be given a new drug to lower cholesterol, while others would get a placebo. None of the people in the study would know if they got the real treatment or the placebo, and then the research would use that to compare the effects of the drug and the placebo, the effect of the placebo and the real drug in the people, like what happened to the people that took them. That way, they can determine the effectiveness of the new drug and check for side effects. However, interestingly, people do have real responses to placebos. Sometimes the symptoms improve and they might even feel side effects, even though they didn't actually receive the real medication. This kind of response can be both negative and positive, and this is what we call the placebo effect.
Hi everyone, I hope everyone can hear me very well. So now we have heard about what placebos are, so I will be talking about something that is the complete opposite of the placebo effect, and that is the nocebo effect. I will start off by listing some of the key facts about the nocebo effect. The term nocebo refers to the Latin word meaning to harm, and the nocebo effect itself is when adverse side effects occur due to a patient's negative thoughts and expectations of a drug. And the nocebo effect opposes the placebo effect. This is because of the unwanted side effects that occur due to a patient's negative perception of the drug. During my research, I also found out that the nocebo effect was described as the non pharmacological effect that occurs from inactive treatment. Common side effects that the nocebo effect may cause include nausea, dizziness, headaches, and insomnia, which will cause physical discomfort within patients, so it's not good. The side effects that are caused are often referred to as non-specific. They are given this name as the reactions caused by the nocebo effect are not directly linked to the drug or treatment. It is important to understand that the nocebo effect occurs due to a patient's own thoughts and expectations. Thus, this should not be viewed as side effects caused by the actual medicine, as it may lead to an actually useful drug to be discarded or discontinued. Okay, moving on. Studies show that the nocebo effect may have a greater impact on clinical trials, which affects the treatment effectiveness. For example, the side effects caused by the nocebo effect may throw people off or displease them, and therefore there might be an increase in the number of patient dropouts in the clinical trial. This is not good as the treatment efficacy may reduce. Next, if we inform a patient about a side effect of a drug which concerns them, that patient is more likely to develop that side effect due to the nocebo effect. I will now set out a scene as an example. In this scenario, a doctor tells a patient about a side effect of their treatment and this worries the patient and drives them to keep thinking about it. As time passes, they end up actually experiencing the side effect because they're so sure that it would happen. Therefore, constant pessimism does not help with the nocebo effect. And in other cases, the nocebo effect can also happen when a patient sees someone else experiencing a side effect. And this will lead them to think that they would also experience the same side effect. And guess what? They would, because they keep thinking about it, and the nocebo effect causes them to experience it. And finally, another factor that contributes to the nocebo effect is a patient being fearful of their treatment or medication. The nocebo effect feeds off a patient's worries and concerns. Finally, I will be explaining the part that media plays in the nocebo effect. Things called the media storms often cause viewers to lose trust in certain medications, and this trust would be very hard to gain back. This is because media storms can spread information about unsuccessful medicine or harmful side effects that really puts people off. People would get a negative impression of drugs. Even if they want to give the drug a chance, they might still have suspicions of it, and this would end up as a nocebo effect. The media can shape what the population really thinks of a treatment or medication. So, how can we deal with the nocebo effect? An appropriate action would perhaps be a doctor communicating thoroughly and clearly with their patient, making sure they explain every aspect of their treatment and potential side effects of drugs. The doctor could check their understanding and address the patient's concerns so they are confident about their treatment. Placebo and nocebo effects are purely a psychological phenomenon, as mentioned in the previous slide. So we could possibly place counseling as one of the options for patients if they're worried or unsure about something. When a patient lets all their concerns out, they could finally feel a little lighter and could also gain more confidence and hope. This in turn could help change their pessimistic views to a more optimistic one, lowering the impact of the nocebo effect and minimizing chances of experiencing those unwanted side effects. Even though the nocebo effect mainly causes distress to patients, it is also somewhat significant when it comes to research. This is because it shows how powerful a negative mindset can be, that it can actually lead to physical discomfort within patients. So, it is vital to take into account the nocebo effect during any research. Thank you for listening.
Okay, so I'll be covering placebos in clinical trials and how they're used in research and why they matter, not just for science, but for how we think about drug discovery and health in everyday life. Now, let's start with the basics. In a clinical trial, a placebo is something that looks and feels exactly like a real treatment, but it has no active ingredient. Now, what's the purpose of it? It acts as a control. From what you might know from school experiments of a control, it essentially ensures that the treatment actually works. And researchers do this to compare it to the true effects of the treatment from what we call the contextual or psychological effects. Now, which are things like patient expectations or the natural course of treatment. Now, without placebos, we sort of risk overestimating how effective a treatment is, and they're set as a gold standard of RCTs, and RCTs essentially are randomized controlled trials. Now, if you look at the image on the left, it sort of goes through the chain of the participant getting a drug and the participant getting a placebo in a clinical trial. And this always involves psychological effects because, let's be honest, what we believe sort of sometimes does get into how we feel, right? And placebo effects, they link to the brain's chemistry. Now, brain's chemistry is essentially the hormones that trigger real symptom relief. And it's not always the medications, but it's sometimes also the psychological influence, right? And here's where it gets interesting. Even though placebo contains no medicine, it can still trigger the changes in your body. And this is not just psychological, but it's physiological. And this includes endorphins, dopamine, and even natural cannabinoids. And these are chemicals that reduce pain, it improves your mood, it calms your nervous system, etc. And this tells us that the belief, environment, and expectations are not just sort of mental, they activate healing pathways. especially in conditions such as chronic pain, anxiety, depression, and even Parkinson's disease. And from the graph as well, you can make out that the total response compared to the placebo response is very mild, right? The placebo response makes up for over half the response to an actual treatment. And that there's a QR code that will pop up on the screen next. If you want to sort of do the quiz, feel free to do it. I'll just leave it on for 30 seconds and then we'll move on to the next slide. Okay, I think we're ready to move on to the next slide. Just see. Okay, moving on, let's consider the ethical concerns regarding placebos. So methodological justifications essentially are core circumstances under which it's ethical to use a placebo. Now, according to Millam and Grady, which are just researchers, you'll get through the references, there are 4 core criteria that must be met in order for it to be ethical. And this includes that there should be no existing proven effective treatment, which sort of links to, is there a treatment currently available that negates the need to use placebos and sort of undergo a blind trial, right? The next one is the risk to participants from withholding treatment. Now, what do we mean by withholding treatment is whether going through this trial process is going to harm any participants. If they're under critical conditions, they cannot take part in clinical trials, and that obviously makes it unethical. Then we have that the trial should be designed to address that the placebo control is necessary to obtain the unbiased data, because obviously we cannot overestimate the effects of a treatment. There is a need to undergo a placebo trial, which will tell you whether it's just the psychological or contextual influences affecting the test. And then the last one is that the trial is designed to address the health needs of the population. So if a drug discovery is mandatory or it's in demand or there is some sort of treatment needed, then it's completely viable to undergo a double-blind trial or any sort of trial, i.e. a randomized trial, which is unbiased, right? Okay, let's move on to open label placebos then. Now, what are open label placebos is, they're traditional placebos which were thought to require deception. However, these studies challenge the idea. Now, in open label placebos, patients are told that they're receiving an inert substance, right? But they're also informed that placebos can still trigger real benefits in your mind and body mechanism, such as what you might expect and conditioning. Now, Kolliker and Hovick, again researchers, they highlight that open label placebos have been shown to reduce symptoms in conditions such as IBS, chronic pain, depression, ADHD, etc. And these effects often occur when the placebo is framed positively. Now, if your participants are sort of just given a biased view on the placebo or the treatment, the trial is not going to be as randomized or as unbiased as possible, right? For example, when you explain that the brain can respond powerfully to therapeutic rituals, people are more likely to believe it, right? And importantly, open label packagings, they remove the ethical barrier of deception. They make them more compatible with informed consent and patient autonomy. The patients are fully aware of what they're undergoing. And this opens a door to everyday clinical practice. Now, this is particularly for conditions where conventional treatments are ineffective or poorly tolerated, and that includes obviously depression and other factors that were mentioned in the previous slide. Okay. Now, let's look at ethical equivocations. Equivocations are just sort of looking at both sides of the argument and making a conclusion, right? Now, again, I've put on a quote from a research article, and assumptions that placebo effect necessitates patient deception is flawed. Now, what does that mean? It challenges the common assumption that non-deceptive placebos are unethical or ineffective. And it's important in getting down to the contemporary bioethics. Bioethics are just scientific ethical knowledge that we're expected to have as people that do trials. Okay, and trust maintenance. Now, what does this mean is every time you're sort of conducting a trial, you're supposed to maintain that participant and conductor trust. Like as a doctor as well, we know that you're supposed to have confidentiality maintained, right? Same goes with trials. Everything within medicine, you need to consider, is a person able to give you consent? Are you able to maintain trust? Are you able to withhold information that needs to be withheld, right? If all of this is considered, the trial can be undergone. So to answer the main question, that is it ethical to use placebos, if the four guidelines are met and if the participant is able to make a decision with the capacity, yes, it is completely viable to make that decision, right? And just to summarize quickly then, we talked about three things. Obviously, there must have been a lot of buzzwords, but to shorten it down then, clinical trials with proven need. If you're aware that the population needs a treatment, it's completely ethical. Now, again, with the condition that there is no known treatment. If there are treatments that still work, then it would again have to go through a longer process to make sure that it is ethical, right? Then we have another condition, which is clinical trials withholding care. If you're not considering what the participants need at that time, what the condition is like, are they critical, are they not, it will be unethical if you're not considering those things. And this again is established through effective treatments, and you need to make sure that the person or the participant undergoing is able to sort of proceed with the trial. And then the last one is open label placebos in practice. Now, in practice essentially is people that undergo it. And this, in terms of is it ethical or not, it's potentially ethical. So it's sort of borderline. You can't really make a judgment based on this. And it's about transparency. It's about what their condition is like. And it's also about standard of care, right? Now, standard of care, all it means is what sort of treatment are they receiving right now? Do they need a treatment in the long term in terms of the drug undergoing trial, right? So yeah, that's to sort of sum up, is it ethical to undergo trials in the first place, and is it ethical to use placebos? Thank you.
Hello, everyone. So, I'll be talking about a brief case study about placebo effect in a vitamin C trial. So, starting off, Thomas Karlowski et al. In 1975 published a common cold study at the National Institutes of Health. So, the placebo drug it included lactose, which can be easily differentiated from ascorbic acid, which is vitamin C, simply just by tasting it. So the findings of this case study showed a 17% decrease in the duration of cold episodes in the group that were given vitamin C, which is 6 grams every day. So, however, the researchers proposed that the decrease was all due to the placebo effect. It was clearly shown that basically the placebo effect is not a valid explanation at all for the results of this case study, since the results were very inconsistent. So, this conclusion is very important for two reasons, especially. So, firstly, the placebo explanation becomes very less convincing when considering that the results of several other studies that used properly designed placebo tablets and still found very similar benefits from vitamin C. And secondly, since the results of the Karlowski study were not caused by the actual placebo effect, they can be used to estimate the actual effects and benefits of vitamin C supplementation instead for the common cold. So, the most important conclusion from the study is basically that therapeutic use of vitamin C supplementation during the common cold appears to be just as effective as regular long term supplementation instead, and that there is a very clear dose response correlation, which basically means that, when a drug is given at very high doses, at least up to 6 grams per day, for example, for this vitamin C supplement, it leads to greater relief of cold symptoms. So the findings suggest that the large doses of this vitamin C supplementation can be actually reduce the severity and duration of the common cold, and it really improves the individual's symptoms as well and how they deal with a common cold as well.
So now I'll be talking about the psychological mechanism of the placebo effect, so basically how the placebo effect works. So although the full mechanism hasn't been fully explored or understood, researchers have found two major factors that likely play a role. The first is classical conditioning. This is a method of learning where a person forms an association between a stimulus and a response. This happens from the person receiving the stimulus repeatedly and having it paired with a similar response every time. This is then remembered, and an association is formed between the two. In the context of the placebo effect, a patient may have taken a pill several times before and observed their pain lowering. As a result, they associate those pills with pain relief. In a placebo trial, they may find a sugar pill to have the same effect as the painkiller because they've been conditioned, even if it's just a placebo. The other mechanism is expectation. This is the idea that a belief in the medicine's effectiveness will change the outcome, which is often brought about by verbal instructions and the environment that the patient's in. For instance, the doctor could explain how their painkiller will affect the patient. This is because the patient is more likely to trust advice from a medical professional because the patient knows they've gone through the training to become a doctor, and so they have trust in their ability, especially in a medical setting. The patient is then likely to feel reassured, which causes the release of neurotransmitters that can mimic the effect of drugs such as dopamine, as discussed before. Because of this, double-blind trials are essential. These are trials where both the doctor and the patient are unaware of whether the medication is a placebo or not. If a doctor knows that they're giving a placebo, they may subconsciously change their behavior, which can affect the patient's expectations. But although a patient's symptoms may seem to improve after taking the placebo, it may not actually be because of the placebo effect itself. A common example of this is when a patient presents themselves when their symptoms are at their worst. When symptoms are especially severe, you might think that it may enhance the placebo effect due to a high expectation of it working, but it's likely that their symptoms would have improved without the placebo anyway, as their symptoms would naturally improve. On the left, there's a graph of how the severity of the flu changes over time without medication. We can see that the severity generally follows a downward trend after day 3 to day 4, and this shows that a patient may find that their symptoms are getting better due to the fact that they were at the worst of their symptoms and would have likely been able to improve regardless. This concept is called regression to the mean, and it highlights a common misinterpretation of the outcome. And this can be an issue as it could lead to false conclusions on the effectiveness of the placebo or the real drug being tested. The best way to combat this is to have a control group that doesn't take any medication at all. If the treatment group has their symptoms improve faster or greater than the control group, then we can conclude that the cause isn't regression to the mean or natural recovery. So just to sum up, the way the placebo effect works is mainly due to classical conditioning and expectation, and an improvement in symptoms may be confused for regression to the mean. Thank you.
Okay, so now I'm going to be delving into the future of the placebo effect. So currently, the placebo effect is still a quite contentious area in medicine, and this is because there's still ongoing debates on ethical/practical implications in how it's implemented within clinical trials and research. However, the field will be expected to continue to grow, and more research is yet to be conducted. As a result, several factors may change, which I'm going to delve into and elaborate more in detail. So the first aspect is the mind-body connection. So current research is quite limited. And due to this, future research aims to explore how there's an interconnected relationship between the strong force of the mind and the body. And hence, this leads to my next point, that placebo mechanisms do support the biopsychosocial model. which intertwines the brain, the mind, and the body. And this links to the mind-body connection and how holistic medicine will play a role in the future. Social prescribing also overlaps with the placebo effect and the mind-body connection. So social prescribing is just a fancy term to describe an area within medicine that focuses on non-pharmacological interventions. And they're looking at implementing a more social prescribing approach in the future. Hence, self-induced mechanisms, which is technically just a fancy term to describe how individuals unconsciously or subconsciously triggers a healing response through their own beliefs/rituals without any treatment and external intervention. Mechanisms are quite substantial in the future because this may transform the future of the placebo effect. And currently, a couple of studies do display some promising results. And if you're interested, you can read further by checking out the resources corresponding to the slide in the citation section. Okay, so another aspect that is predicted to very likely change is a change in clinical attitude and approach. So currently, a lot of healthcare professionals and physicians have a very limited understanding of the placebo effect. There's a lot of misconceptions around it. However, this will continue to evolve because a lot of healthcare professionals will develop a strong understanding of this. And essentially, this will lead the placebo effect to become a strong neuropsychological tool, which links to holistic medicine, social prescribing, and more. And hence, the primary target is to just increase positive responses from patients in the future. And by this, the clinical attitude and approach will change as a result. Another aspect that definitely links to the future of the placebo effect is the changing scope of ethics. In the future, the landscape of ethics will definitely transform because they're going to encourage more open-label placebo use, as Safa stated, and dose extending will override barriers in ethics, leading towards more clinical and research use. And hence, ethical innovation will occur. And thank you.
Okay, I'll just quickly talk about the main points throughout the whole presentation. So, the placebo effect shows the belief and expectations can cause a real life health improvement without using a curative substance. The nocebo effect produces negative symptoms due to negative expectations. In a clinical trial, placebos act as a control and can trigger physiological responses like dopamine release. Ethically, the use of placebo should be carried out with regards to the 4 set guidelines. The psychological mechanism include classical conditioning and expectations of medication. A vitamin C case study illustrates how placebo and real effect can be difficult to separate, and the future of placebo uses lies in mind-body based medicine, ethical innovation, and holistic approaches. I really hope you guys enjoyed it, and thank you very much for listening.
Okay, thank you all for listening. Very well done to our presenters. Please remember to fill out the feedback form for a certificate. I will resend that in the chat now. Other than that, feel free to leave unless you have any questions. Presenters, you will all be receiving individual feedback within the next few days. Excellent work, everyone.